Hey Saul, how's it going?
Doing well, how are you?
Good. I'm student doctor James Rock.
Nice to
I'll
meet
be
you.
helping you out today. So
All right.
if you just follow me, we'll go in here and just kind of go over your medical history and get things going.
Okay.
Come on in. So Saul, go ahead and tell me a little bit more about what brings you in today.
For the last 2 weeks, I've had pain in my jaw
Okay.
when I'm chewing, usually. But then it comes and goes. Sometimes it's perfectly fine. But if I have a cold one, it usually tends to hurt more.
Okay.
Or if I have like anything cold, my teeth get sensitive. And then I'm also looking to maybe change the appearance of my teeth a little bit.
Okay. What do you not like about your teeth?
Well, I kind of want to get something a little more flashy, more attention grabbing.
Okay.
I just am working on a new job now, making mixtapes as a DJ, so I'm going to promote that.
So want to get something maybe a little more flashy going on up front?
Yeah, we call it bling in the streets. I don't know if you know about that.
You know, I think I've heard about it, but I'm in here cooped up all the time, so.
I don't know what you dentists call it technically, but you put something nice on the teeth to make it look shine.
Well, definitely something we can look into.
But that's secondary. Obviously, I want my teeth to feel better first. If you guys could do that.
So, what were you doing, or I guess when did you first notice the tooth pain? Was it while you were drinking something cold, or?
No, I was playing baseball and I hit the head with a fastball.
Oh, okay.
Which might have something to do with it, maybe.
Okay. How long ago was that?
Like a month.
Okay. So you've been dealing with it for a little while now, huh?
Yeah.
Okay. Well, just to give you an idea as far as what we're doing today, I'm sure you'll probably have some questions if you don't already have some. But the reason why you filled out some of that paperwork outside is just because we do screen for patients here, since it is a university and where we are students. There is kind of a set criteria as far as what kind of patients we can accept and can treat versus those that we can't. Obviously, if it were my way, we would try to accept everybody if possible.
Okay.
But I can definitely, do my best to see that I can help take care of this for you. Any other questions?
How long
you
does
have
this
for
whole
me?
screening process take? When would I know?
We're
I'm in a lot
gonna.
of pain and
Yeah, no, for sure. We're gonna do the screening right now, if that's okay with you.
And then even if I'm not accepted, could you guys give me something for this pain? Because that hurts a lot.
We'll definitely look into it. But like I said, just in case there are any other underlying issues that you might have, or I need to know about those before we actually. So Saul, I was looking over some of your forms that you filled out while you were out there.
Yeah, what was up with that? Why do I have to fill out all this paperwork for something that's just like a pain in my mouth?
Yeah, no, great question. So the reason why we do fill out that medical history is just, again, to make sure that first off, that there is treatment that I can do without getting in the way of other things that you maybe had in the past. We do treat people as a whole person. Just because you have dental pain doesn't necessarily mean there might not be some other things that could impact that dental treatment. And while we're on that subject, have you had any complications with dental treatment in the past?
No, not that I could think of.
Okay, other than what we already discussed?
Yeah, I think I've never had anything go wrong or.
Okay. No. But no allergies or any sorts of medications?
No allergies. I'm not really on any medications right now.
Okay.
Just take multivitamins and stuff like that.
Okay, perfect.
But nothing prescribed or anything.
Okay.
Like I said, my mouth really hurting.
Okay. Well, let me give you an idea of what we're going to do. That way you at least know or have an idea. So basically what I'm going to start out doing is just checking kind of the outside of your mouth and face, making sure there isn't any sort of unusual abnormalities there. And then we'll just take a look on the inside of your mouth too. If you're like me, you probably don't like needles.
No.
Okay, so to give you some comfort there, we're not actually dealing with any needles today.
That's
so
good.
I don't know if you've had any experiences in the past with the dentist that you haven't liked, or?
I don't like dentists.
Yeah? How come?
Well, my ex-wife was a hygienist.
Okay.
She took my dog, took my house, half my money, and now it's just no fun.
Yeah.
Not to mention dentists usually, I just don't like them, man.
Yeah.
I just don't like them. If I wasn't hurting, I wouldn't even be here right now.
No, definitely.
And then, yeah, you guys take too much time. Keep me waiting in the...
Well, first off, thanks for coming in. I know it's not an easy thing to do, and honestly, these white coats sometimes can kind of scare people. But as far as time goes, since it is a student-run clinic, it typically will take a little bit longer than what you're probably used to in private practice.
I
But
don't
the
mind.
bright side is
I
though,
don't mind if you guys take your time working on me. What I don't like when I go to the dentist is when I go there, my appointment's at 10, and I'm sitting there for an hour and a half in the waiting room.
okay,
My time's valuable, and if you guys don't respect that, then we're gonna have issues.
no, like I said, I mean, thank you for coming in. My time is just as valuable. So to have you here is just honestly a great thing for me. So thank you.
Okay. Thank you.
Okay, so up till this point, are there any other questions that you might have or anything that I could help clarify a little better?
No, it seems like you did a pretty good job of explaining everything.
Okay,
I think I understand, the process and the protocol here,
okay,
so.
alright. Well, one good thing about what we're gonna do today, have you ever heard of what's called a pano or panoramic x-ray or radiograph?
I don't think so.
Okay, so basically what we're gonna do is we'll go back here a little ways in the room, and this x-ray is basically gonna take a shot of your full mouth. And the reason why this is gonna really help us today, especially with that pain that you have going on, it's gonna help me see a little bit better about what's going on underneath your mouth that I can't see so well from here.
Okay,
That way we can definitely get after this pain, because after all, that's why you came in.
right, okay. And then if this, I think I might have had this done before, now that you mention it, it's kind of common in dental offices that is done.
Uh-huh.
So if there's something you guys find there that, outside of the pain, or some other issue that pops up, will you guys be able to take care of that as well?
Absolutely, yeah.
Okay,
I mean, definitely we'll look into doing as much as we can just to make sure that you as Saul can feel better, you know, not just the pain, so.
okay, that's very, helpful, thank you.
Okay. Any other questions that you have about what we're gonna do today?
No, that seems pretty straightforward.
Okay, well, if it's all right with you, can we go ahead and begin the screening?
Yeah, I think we could do that.
All right.